Hi, welcome back. A major theme of these discussions has been one that I want to try to add a little to by way of refinement, and that is one of my major concerns is psychiatry's medicalization of the mental health field. That is the effort to work with people who are having mental problems. Uh, that's not the same as them having a medical problem, but since psychiatry is a branch of medicine, it has evolved that the influence of psychiatrists and other sources have taken the mental health field in a medical direction, which I think is way overboard. That doesn't mean, however, that there is not some role for medically trained mental health professionals. That is the psychiatrists. So I want to spend some time today talking about what they would do in the kind of changes that I'd like to see and other reformers have been talking about. What would be the role of psychiatrists if they were not doing the over-medicalizing that they're doing now? The diagnosis, making it look like it's a diagnosis when it isn't a diagnosis, the over-medicalization of treatment, the excessive use of drugs, and so forth and so on. Well, I would say one of the primary things that we need medically trained people in the mental health field is to assist other doctors who are treating people with medical disorders. If you're in the hospital for any variety of conditions that might influence your mind, your behavior, or your feelings, of which there are many, it may be very important for a medically trained person to be available to work with the rest of the medical staff. For example, let's say that you're in the hospital for a condition that has not yet been determined. The diagnosis has not yet been established. Is it some kind of something that happened in the brain, like epilepsy or stroke, or some kind of injury, and it's not yet apparent what that is? Maybe it's a metabolic problem, a hormonal problem. Variety of medical diseases can manifest themselves in somebody's thinking, somebody's behavior, and somebody's emotion. Because of course the brain, which is the seat of our emotions and our behavior, is part of the body. The blood, which goes all over the body, also circulates through the brain. The lymphatic system, the nerves that control other parts of the body also are related to the functioning of different parts of the brain. This marvelously complicated organism. So there are times when medically trained mental health professionals, of which I am one, and all psychiatrists have that kind of training, they can combine their medical background and their mental health background to assist. I have many recollections of times where I have had the opportunity to consult with physicians who were treating people, and they were trying to decide, does this patient have primarily a psychological problem in which the behavior and the findings that we see are only come from psychological causes, or are there medical diseases which we can hope to determine which are the cause? And the treatment, of course, would be very different if you have a known medical cause versus if you have a psychological cause which cannot be pinned down with medical diagnoses because there is no known markers or tests for psychological phenomenon, as we've talked about in previous discussions. And one of the ways that I've helped people in the medical field is to remind them of something they may have learned, but they may have been, not come to the front of their thinking in their diagnostic workup is, does the person demonstrate what we call fluctuating states of consciousness? Are they clear and rational sometimes, but at other times they seem to be out of touch with reality? You can't really communicate with them. One of the hallmarks of an organically based or a medically based problem. And in that case, if I, after reading the record, trying to examine the person, talk to people who've been working with the person. The conclusion is this is something with shifts during the day. I would tell them, it appears to me there is a medical cause here. I have no way as a psychiatrist of knowing what it is, but keep looking in the way that you're looking. Do the tests that you have, because I don't think it's a psychological cause. In other cases, it's been the other way. The person who's having a psychologically based disorder does not tend to go back and forth within one day's time with anywhere near the frequency of somebody who does have a medically based cause. So that's just one example. We're not trying to do a medical case conference here, but just one example where we do need medically trained people to work with other medical doctors in helping them establish a diagnosis or determine that there isn't a medical diagnosis that is really helpful, and some just understanding of their mental problem is what is in order. You notice I don't say make a diagnosis of the mental problem, because the minute you get into the psychological realm, then the concept of diagnosis doesn't work. And just to repeat what I've been saying in the past, the reason it doesn't work is that medical disorders come as discrete categories. There's a pathophysiology which can be determined, tests which have independent verifiability. It's real science at work. And diagnosis leads to treatment. Diagnosis is when you find the cause, then you know what the treatment should be. The minute we try to move that into the psychological realm, the so-called diagnosis only becomes a summary of symptoms, and symptoms do not tell you what the cause is. So therefore, we don't have a diagnosis. We have a repetition. We must satisfy ourselves with understanding the patient. It's not nearly as objective as the rest of medicine, but it's the best we can do, and it's better than placing this supposed diagnosis on the patient and therefore leading us to treatments which are irrational. One of the best evidences that when that's happening is when you see psychiatrists trying to treat a so-called diagnosis, when they're not satisfied with the response they're getting, they change the diagnosis because the drug isn't doing what they wanted to do. That's not the way it's supposed to work in medicine. If you have good evidence for a diagnosis, the response to treatment is not the way you decide what the diagnosis is. That's getting it backwards. In all these situations, good psychiatry and good medicine come together to benefit the patient. You use science when it is available to you because there are diseases that you can diagnose. But you move over to the psychiatry when you have a problem. The problems have not gone away just because there's not science that can help. But because you don't have a scientifically based problem, you have a problem of their mind and their behavior and their feelings. You have a human being who needs help. Then you move over into a realm where by not making it into science when you can't, you have a better chance of helping the patient. One of my major concerns is helping you protect yourself against some of the trends that are increasingly surrounding us all that have to do with this issue of mental health and the brain and various things that you hear that are supposed to be good for you. We've done a lot of talking about the issues of medical diagnosis, what's real diagnosis, and what passes for diagnosis. And I've talked to you about how, in my view, psychiatrists don't have any real diagnosis because the nature of mental problems doesn't allow itself to be categorized in that way. So I don't need to repeat that for right now. But I just wanted to let you talk to you a little bit about the fact that the misinformation that is increasingly coming around and going around isn't just coming from the psychiatrists promoting the medical view of mental disorder, but there are so many industries and activities which are getting on the bandwagon of this approach. And I just want to give you an example of one. There are, of course, countless others. But if you tune into this, maybe you'll be more sensitive to some of the other ones. So let me read you something that you can find every day on the web. I happen to get this from a site that deals with medical issues. And the subject is lithium. Lithium is a mineral that occurs in the Earth's crust. It's pretty widespread, but not especially abundant, except in certain parts of the world. And it's not a food. It's not something that the body normally will have in it. The body might have some lithium in it if you happen to live in an area where it's in the drinking water or somehow got into the food by being in the ground. But it's not a nutrient. It's not a part of the body. But once lithium began to be used by psychiatry, starting in the 1980s and a little bit earlier, it began to be touted as a substance which could treat some things and then more things. And by the time 20 or 25 years ago went by, it was then being used with children and given on a basis which was said you have a chemical disorder, lithium will help correct it. Let me read this quote to you as an example. It says, lithium acts on a person's central nervous system, brain and spinal cord. Doctors don't know exactly how lithium works to stabilize a person's mood, but it is thought to help strengthen nerve cell connections in brain, regions that are involved in regulating mood, thinking, and behavior. End of quotation. Well, that sounds like pretty good stuff. It's supposed to help strengthen something in you, and it's going to regulate mood, thinking, and behavior, and stabilize your mood. These are all nice, tranquilizing words. The fact is that lithium has no known presence. I mean, in other words, it doesn't function in the body. If it's put in the body, it's going to cause problems. If it's not enough to be felt to be causing problems, that doesn't tell you that it isn't causing problems until maybe you would know later on that it's caused a problem. When it's put in enough dosage to be used in a psychiatric context, there's a real possibility that you can end up with long-term kidney damage, thyroid damage, and many other possibilities. So when you read phrases that say, we don't know what it does, but it's thought to, and then they give you a list of things which sound pretty good, don't trust it. There are people behind it who have a reason to want you to take it, whether they're vitamin suppliers, whether they're manufacturers of psychiatric drugs. Protect yourself. Get educated and don't trust claims which sound too good to be true. Adding chemicals to your body that have not been demonstrated, and they would have been demonstrated through legitimate sources, are not going to help you. They're going to put you at risk. So the message is the widespread use of chemicals for mental problems which are then conceptualized as medical diseases is creating whole layers of extra industries besides treatment by a psychiatrist. Nutritional industries, vitamin industries, and so forth. Take care of yourself. Come back and see me next time.